What's up, guys? John here for Black Wednesday, Titan Medical Center. This is the 6 p.m. giveaway. Heads up. So this is the last giveaway of the day. We're doing blood test giveaway. We're doing Titan gear giveaway. And we're mentioning the discounts for everybody. One more time. What's up, guys? Thank you for joining me. I appreciate all you guys. So this is going to be great. How you doing? So we're going to be getting it in today for the last giveaway. So it's been a great day. We've gave away a lot of blood tests. I think we gave away 5 or 6 blood tests already. We've given away a lot of Titan gear. And a lot of patients have been calling in, taking advantage of the discounts. Plus, we've had new patients taking advantage of the discount on the blood work, even if they didn't win. So, if you guys want me to break it down, I will for you one more time. We're doing a discount for vitamin amino acid injectable therapies, $50. If you're a new patient signing up, you'll be able to get $50 off of that vitamin amino acid injectable therapy. If you're on HRT with us, you'll get $50 off your total package one time, okay? So at that point, you guys will get the benefit. All you gotta do is mention this, do it today. So if you ordered previously, don't worry, call up today, take advantage of it, get the discount, get the credit in your account, whatever it may be. And at that point, you guys can utilize it. That's what it's all about, giving back to you guys. Black Wednesday, Titan Medical Center, we've been doing these things for years. So we've always had some great participation in this, and we've had great feedback throughout the years. And everybody's been really happy with what they've been getting. And every year we really step it up. So this year, we're doing a discount for you guys, $50 off. I told you guys, new, old patients, vitamin and amino acid injectable therapies, HRT. If you guys are already on with us, you guys will get $50 off that total package of whatever the total number is on that. Okay, so take advantage of it today. We are going to do the blood test giveaway. We'll do that here at the end. What up, DC Baker? I want to do 3 giveaways today. So we would do lunch, the middle of the day, like 3 p.m. and 6 p.m. for everybody that had to work, 9 to 5s, and possibly getting off work right now. They're in traffic on the way home, right? Or they're at home, they're off work, where they at least can take advantage, watch, and possibly win. The last giveaway at 3. Richard, text the line, and I'll make sure after this that I find out, okay? Make sure you DM us your full name to it, and I will definitely get it in. I'll make sure that you're somebody that has talked to you if they haven't got contact you yet. So let's get into some of the different things. So blood testing. We talked about the blood test and kind of what it covered. So we go more in depth in blood testing. So when you guys get this blood test, it's going to be able to show you a lot of different things that maybe you've never seen before on a blood test. What does it cover that's different? So it does cover the basics. So when we talk about blood testing, you really want to cover your organs, right? Your organs are essential for you to live, like your liver, your kidneys, right? For guys, we want prostate. We want to look at cholesterol levels. We want to look at electrolyte levels. We want to look at white blood cell count, red blood cell count, hemoglobin, hematocrit. Make sure your blood's there. Platelets are good. There's no infection with the white blood cell count. Red blood cell count and hemoglobin aren't too high because that means your blood's so thick that it won't get through. It like turns into sludge at a certain point. So you want to make sure that's all good, right? Then we're going to go a little bit more in depth. We're going to look at a full thyroid panel. TSH, which is a thyroid stimulating hormone. And we're looking at T3 and T4, and these things affect of how much and what's produced in the thyroid. Because your thyroid is essential. And your thyroid controls a lot of things too. As we mentioned, it's a hormone. So these hormones can do weight, they can do hair loss, a lot of different things. So thyroid is definitely important. Now, when you look at other hormones, we want to look at this. And now, males and females have all the exact same hormones too for you guys. So I want to educate you there, because if you did have that question, I'm answering it. Males and females have the exact same hormones. And in some of these hormones, some are more masculine dominant hormones, like testosterone, but females still have it. The difference is it's at a different range. So for a masculine hormone like testosterone, males and females, it affects them the exact same way. Okay? The only difference is one has more than the other one, or should. So males are going to have more of a masculine hormone like testosterone, so it's at a greater level. But females will still have it too. Like I said, it affects the exact same thing. Libido, concentration, energy, metabolism, cardiovascular, sugar levels. There's a lot of different things. Hormones are signals that direct your body to do different things. So that's what it's really all about. Now, on the free and total, you want to go over what these things are doing. So what is a free testosterone and what is a total testosterone? A total testosterone is what you have total in your body. This is what is like a reservoir, right? It holds all the testosterone. Your free testosterone is the bioavailable testosterone. This is what your body's utilizing. It's working. It's pulling from the reservoir of the body and actually binding and going through. So you want both of these to be optimal. Sometimes patients have good total testosterone levels, but horrible free testosterone levels. So you want to help free that up and utilize it so you're getting all the benefits of your testosterone. You don't need it to be crazy high, right? You want it to be in range, but you want it to be optimal. So if you have to do testosterone replacement therapy, you want to at least get to optimal levels. So you're feeling good, right? You're performing good. Quality of life is key. It's key to life. It's not about getting big or getting jacked. Yes, some people like muscle, some people want more muscle, but it's not about that. It's really about well-being and quality of life. Are you healthy? Because if you're not healthy, you're not getting out of bed. I don't care. It doesn't matter. If you're not healthy, you're not doing bodybuilding, you're not doing contests, you're not going to your job, you're not going on dates, you're not doing anything. What up, Amanda? How you doing? It's good to see you. So really look at these different things. So that's a free and total testosterone. Now, we look at estrogen levels. Estradiol particular with a male, and that's E2. These will affect different things like water retention, irritability, being sensitive, crying, like Frisky commercials, or something that's really, really sad that you normally wouldn't cry about, okay? Don't be a crybaby. Make sure that's in check. Other things that could happen, possibly with high estrogen levels. So higher estrogen can cause cancer. We know that. High estrogen receptors, cancer. The next thing is it does create tissue. So you don't want to cut all the estrogen out of your body too, right? Because it does create some tissue. Now, if it has an abundance of estrogen, like estradiol is real high for a long period of time, it will create tissue in the breast area. Gynecomastia for you guys. So you don't want that. That's why females, they grow breasts, right? They grow that breast because they have higher estrogen levels than us males. But for guys, you can do it too. And the only way to correct that is to get surgery. So you get gynecomastia surgery, and they have to cut some of the gland out. Now, some doctors, they cut just pretty much, I'd say about 90% of the gland out, and some do it all the way. Now, what can happen all the way is the nipple can be actually inverted, so it actually pushes down in. You don't want that either. So if you're going to get a surgery, you want your surgery to be aesthetic. Now, some guys need it. Some guys need it naturally. Some guys have never took testosterone or anything like that, and they've had, like, basically they've had high estrogen levels when they were going through puberty. Their hormones were off in one way, shape, or form, and they got gynecomastia from that. So these people need corrective surgery as well. So at that point, if you don't need corrective surgery and you're going to go on testosterone, or you want to at least check, make sure you do estradiol levels for guys and for females. Now, for females, you're going to do total estrogens as well. So you guys are going to have a lot more estrogen in your body. Now, it shouldn't be super crazy high either. It should be within your reference range. And this can depend on a couple different things with females, like what follicular stage you're in, like where you're at in that month, or that time, and this can correlate with what's going on with your hormones too as well. So it's really in depth when we start looking at this. The next thing, progesterone. Now this can cause different things for different people, as far as anxiety, hair growth, a lot of different things. Progesterone really do help with, especially anxiety sometimes. So progesterone is key. Now, it's not really crazy, and taking a lot of progesterone can make you tired. So usually progesterone is taken at night from some patients, most patients. These things can be done in a cream. They can be done in a capsule. It just all depends on the person. The next thing, IGF-1 levels. Insulin growth factor 1. What is insulin growth factor 1? So IGF-1 levels are what growth hormone turns into in the liver. So what happens is the pituitary creates the growth hormone, it goes down to the liver, it converts, and then turns into IGF-1. At that point, IGF-1 is what you get all the benefits from. So when your IGF-1 is good, you have good skin elasticity, libido, hair, you're feeling of well-being, you're not tired, you're looking good, you're aging at a slower rate. Usually people that age or look really well on the outside and they look older, you're like, wow, how old are you? You're 60, you look like 40. Usually their IGF-1 levels are pretty good. So at that point, it could be genetics, it could be something else they're substituting or supplementing. And at that point, that's what you really want to look at. Now, you don't need crazy high levels. Crazy high levels of IGF-1 or growth hormone can create all different cells in the body, cancerous cells. So if you have cancer, it can actually speed up cancerous growth in the body and the cells. And you don't want that either. So it's really, really important to look at your blood work and look at your family history. Maybe you have cancer in your history of family. And that's not good. So you want to make sure you take all these things into account when you're going with the medical provider. And the medical provider here at Titan Medical Center, they will look at that stuff. So if you're getting from an outside source or a doctor or something like that, make sure you be very careful, because you only get one body, you only get one life. Make sure you guys are taking care of it. Make sure you guys are getting monitored to the best of your ability, right? Or the best of their ability. If they don't really specialize in it, how can they really help you out? If they only dib and dabble in it, how can they really help you out? That's all we do at Titan Medical Center. We do hormone replacement therapy, medical weight loss, vitamin amino acid injectable therapies, rejuvenation detox, libido enhancers, or those bedroom enhancements, and rejuvenation detox, and a lot more. So at that point, this is what we do. Preventative, anti-aging. We're going to make sure you guys are performing, looking, and feeling your best. All right, guys, so we're going to give away a blood test. The blood test is going to be given away on Facebook. You guys are going to do right on the live, if you guys are on there right now. And you guys can do the pick a number. And I will randomly do this for you guys, where we are picking the number for you guys live and just doing this so you guys see numbers, on the Facebook and on Instagram, so you guys can see it. Really, really cool. We'll pick the numbers. All right, so we're going to go on about that in a second. So here I want to do both Facebook online and here, okay? So thank you, prostate cancer survivor joining, Paul Romano Fit. How you doing? Ilmax already put his number up, 36. Put your numbers up. So I'm going to pick one off Instagram and I'm going to put one off Facebook. So keep putting your numbers up right now, 1 through 100, and we will pick here at the end of the live. And it's not going to be a long one. I got about 15 more minutes. All right, guys? So here's what we're going to do. Let's break it down to some things that could help you guys. So when we talked about IGF-1 levels, talked about growth hormone levels. We talk about raising these things. A lot of people throw that word around, growth hormone. I see some over-the-counter products trying to pass as growth hormone as their marketing, which is pretty smart on their behalf, but it's not really growth hormone, okay? So when you guys are looking into this, the best way to do it is to stimulate your own growth hormone as natural as possible. And this is, you look at it, how can you do this? So there's a couple different ways, and if you look it up, you'll see. So the first thing is what is growth hormone? Growth hormone is a 191 amino acid sequence. So basically what it is your amino acids just sequenced in a certain way, 191 of them. And that creates the effect of growth hormone to produce and go down the liver, and that's how it happens in the body. So amino acids are very, very important. Now let's talk about some amino acids that are very important. So we talk about arginine. Arginine is a big one. L-citrulline is a big one. These are great ones and precursors. So if you're taking these injectable, and we have these in almost every blend, you want to really take these things in the morning on an empty stomach. And at that point, get the best possible function from these things. And they possibly might help you raise your IGF-1 levels. The next thing, we look at some of the medications and prescribed therapies that we have here at Titan. We look at Semirelin, which is a dinosaur. I will tell you straight up, Semirelin. But it was the first one out as a GHRH. It was a growth-releasing hormone. It helped patients sleep better at night, and it helped them raise their levels. Not a whole bunch, but a couple points, 30, 40 points. And on IGF-1, that's pretty good. You might want to raise more, but hey, listen, if you're getting some out of it, and it was more natural, what it would do is it would stimulate your own pituitary to produce your own growth hormone, but not overstimulate. Because if you overstimulate, you could suppress. And if you suppress your pituitary, you'll probably, maybe not ever get a kickback on or as good as it was producing before, okay? So it's key, right? You want to do the most natural thing as possible if you can. If you have to replace it, that's a whole different thing. There's some people who have lost pituitary function, and at that point have to be on growth hormone. So that's prescribed because of that. Because some people have a lot of issues, even dwarfism. That's what growth hormone is prescribed for. Dwarfism, growth hormone deficiencies. There's a couple out there, but it's not heavily prescribed out there, and there's reasons, because the DA looks heavily down on it. They don't want it prescribed, and it's very, very expensive. Okay, so if you're getting it cheap, definitely scratch your head. I don't care how much your friend or people tell you they're getting discounts on it. I'm telling you, it comes straight from the manufacturer to the pharmacy. And if you're not getting it from a pharmacy and you're getting it from some clinic per se or whatever it may be, I would definitely watch out and make sure that you're at least getting it back where you can verify that it's real growth hormone from a real pharmacy, has your real name on it. That's one thing. Titan Medical Center you get all your medications of your patients, from the pharmacies. We don't ship directly to you guys. It doesn't come from here. We don't create it. We don't make it. We gave them our formulas. They make them for us. They ship them to our patients, and that's how it works. It's very simple, very easy. All you guys got to do, if you guys aren't patients, if you guys want to know more information about therapies, call or text 727-389-3220, and I'll be happy to help you out and talk about some of these things. All right, guys? So the next one is CJC 1295. We talked about Semirelin. Now let's talk about its predecessor, CJC 1295. Now the difference is it helps you produce your own growth hormone. It just has a longer half-life than Semirelin. That means a better result for you because it's more extended in the body. It should help you produce more. So at that point, CJC 1295 and Imparelin, which is like a GHRP, a growth hormone releasing peptide, will help both stimulate posterior and anterior of the pituitary so you can produce the most amount of growth hormone without suppressing, without overstimulating, because that's the key too. You're right. You want to do this at the right doses and do it correctly. Otherwise, you could set yourself up for failures in other departments. Okay, MK677. It's the only oral GHRH. Now, when it first came out, ibutamoren, that's the name of it, MK677, people were saying it was a SARM. A SARM is a select androgen receptor modulator. This is not a SARM. So let's get it right. Let's be on the same page. It is a GHRH, growth hormone releasing hormone, GHRH, not a select androgen receptor modulator, a SARM. It's not a SARM, GHRH. So what is it and what does it do? So it's an oral capsule you can take. Usually it's 25 milligrams for the patient every day. You can take it any time of the day. Now, some people it affects in different ways. So it might make people more lethargic. We tell people to usually take it before they go to sleep. That way you have a good sleep, you're deep in sleep, your body's repairing itself. We know that sleep and that trance 5 sleep is really, really what you want. That's when the body really repairs itself and goes above and beyond. If you're in twilight per se, and that sucks, you're like halfway up, halfway sleeping, you really don't get the proper rest and your body doesn't really recover or do what it needs to do for you to work at optimal levels. And this can affect brain function, cognitive function, energy, just a lot of different things, you're doing through your day. Make you slow, make you sluggish. So really, sleep is important. I know a lot of people, they come to me and they say, listen, John, I need something for sleep. We have all kinds of different things, but you not getting to sleep could be something underlying that's going on in the body. And that's really where the blood test will kind of X some of these things out, or some of the symptoms that you guys put in your new patient paperwork. When the medical provider comes across it, we've seen thousands of patients. We know what's kind of going on with these red flags. So at that point, be honest on that paper, what's going on symptom-wise. I see a lot of people when the egos come out on the paper like, I don't have anything wrong, I don't have anything wrong, I don't have anything wrong. Well, why are you here? You're saying that you want hormone replacement because you think something's wrong, but there's nothing wrong on your paper. There's no symptoms, there's no nothing. So at least be honest. Take the ego out of it. Nobody else is going to see the patient paperwork except for the medical provider and the staff to help you get to where you need to be. All right, so that's really, really important, guys. Another thing I would say is don't list these black market things. I seen something come across about Tren and this and that. These are not human prescribed medications. They're not from U.S. licensed pharmacies. We're not black market. We don't deal with black market. We don't deal with anything underground. We don't deal with anything from any other countries. So even if you got your medication in Costa Rica, I'm sorry, but we don't recognize that here. Not to say it isn't real, but we don't recognize it here because it's not a U.S. licensed pharmacy, and our medical doctors are U.S. licensed doctors. That means that they're only going to deal with U.S. licensed medications because there's something in place to help us know that those medications have at least been tested and we know what you are going to get from the pharmacy, all right? So it's really, really key that you do that because even injectables, we're talking about injectables. So they got to be sterile, right? That's one thing. But you're injecting your body. You want to at least make sure you're safe. You got the peace of mind. Like you're not going to get an infection. You know exactly what's in it. If there's a problem, we can always see what's going on and we can always trace it back, right? That's the best thing I could say about it. So that's key. If you guys are just joining us, thank you very much. Giving away a free blood test. All you got to do if you're on Instagram is follow it, put the number down, 1 through 100. You guys will win a free blood test on there, and I'm doing one for Facebook. So at that point, they can do it right on their live. Hashtag your number, tag 3 friends. On here, please hashtag, tag 3 friends. You can write right in the comments, and let's see what's going on. I'm going to pull my phone out so I don't miss anybody on these, too, as well. what we'll do first is we will give away the free Titan gear. So when we talked about the Titan gear, I actually wore one of these shirts earlier. I've got one of these on. I've got a couple sizes in these. The turquoise, these are really nice. I just got back from the gym right beforehand, so you guys can get one of these, right? I actually put on one of the 3/4 baseball tees, and we got these in all types of colors. Charcoal gray, black and white. We've got some sizes in these, not all of them because they did go, and we still got a lot back there. Sleeveless hoodies. We've got those. We've got stringers. We've got these awesome basketball jerseys, and we've got these in all different sizes. So even girls, we've got these in small, and my wife Sharice and all the girls love it because they can wear this, and they can wear this with like shorts and stuff like that, and it is small enough for you guys to win and wear out, so that's really, really cool. We've got them in all different types of colors. Then you got the turquoise one in that, baby blue, and then a black and red. Not like the red one you just seen, but all black and then red lining. This one's really cool. I love this one. Reminds me of Miami. I live in Florida, and like this turquoise is just, it does something for me. I love it. Sleeveless hoodies, so you guys can see it. I've got these in all different sizes too, so you girls can take advantage of this too. Plus, I have the leggings for you guys. I want you guys to win the leggings. So let's do it. So, all right, the first one we will do size small. Yes, we have size small on all these too. Let's do let's do the giveaway for the clothes first. All right, so you guys got 1 more minute to hashtag a number, and then we will go on from there. Let's go. Hashtag a number if you guys want the free Titan gear. And I'll just stop. I'll just keep doing this until we stop. Can you guys see this on Instagram? Looks like it's like wired out.
You gotta turn it to the left or the right. Up and then the other way.
Oh, there we go. All right. 1 through 100. Let's go. Actually, yeah, let's do 1 through 50.
Oh, we've already got a bunch that's 67.
Don't worry about it. Let's do 1 through 100. Then I'm not going to change it up on you guys. I want you guys to win. If you already paid for the blood test, you should have got a discount on it. I'll definitely hook you up. I'll definitely do a t-shirt for you, whatever you want. Just text in the 727-389-3220. We've got hats too, fitted hats. So if you want a hat, you want a shirt, I got you. 11 Fitness LLC, I got you, dude. Don't you worry. I promise we will take care of you. All right, so let's do a number here. Ready? 1, 2, 3. 97.
No 97 over here.
See? All right, next one.
17.
17.
Double check. No 17.
Anybody got a 17? So many. I'm loving it, guys. Loving it. All right, next one. 95.
Nope.
See, the 1 through 100. Yes. All right. J-Dog, what's up, dude? So we're doing a giveaway right now for Titan gear. We're giving away Titan jerseys, Nikes, 3/4 fits. We've got basketball jerseys. We're going to give away a free blood test too very shortly. So stay tuned. 53 plus. If you guys are a patient,
We got a winner.
we got a winner on Facebook.
Yes.
If you guys are a patient or want to be, we will give you guys $50 off your vitamin amino acid injectable therapies, or if you're on HRT package, $50 off the total at the end. So take advantage of you guys are patients. If you guys aren't patients, we can give you credit for that, all right? So let's go. The next one on Instagram. 30. Got 48. Got 69. 37. 49. Ilmatic to 36, 75, 15. We got a 99 big Vin. Do we got a 30? Not yet. 36. Wow, we got so many. Thank you guys for tuning in and doing this. I'm happy to be giving this stuff away. All right, next one. 79.
You're doing the Instagram right now, right?
Instagram, I'm doing. Facebook, you guys just won.
Yep. Amy Russell.
Amy Russell, congratulations. We've got leggings, tank tops, all different kinds of stuff for you, I promise. You can get your pick. I'll send you out a shirt with the leggings if that's what you'd like. One more. 14. Come on, guys. Come on, guys. Here we go. Here we go. Here we go. Come on. Wow, wow, wow. All right, next one. 66. I will nail one of you guys here soon, I promise.
It's like Titan Bingo, Stacy said.
It's like Titan Bingo. That's right. Is that Stacy Masita?
Yeah.
We love you, girl. She's walking around town showing that LV. 23, my favorite number. I don't see a 23 yet. Not yet, not yet, not yet. Next.
Oh, never mind. That's Facebook. Oh,
Yep.
he just put a 23. It's too late.
1. Nope. Ilmax at 34 is his final number. 81. 34. No, not yet. 40. Who's got 40? Gosh, guys, I'm surprised you didn't nail this. I see a whole bunch of people on here. Ooh, Son of Stewart just did that. Barely missed that. 58. This is so funny. 35. I don't want to miss anybody. So I'm going through all these. Just excuse me. I'm going to make sure. 86.
Nothing yet. Also, you can only pick one number at a time.
58. Do we got a 58? 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 92. I didn't see one of those. 48. If you're the winner. Oh, Tattooed Mommy, 48. Tattooed Mommy, 48. Awesome. You've won free Titan gear.
Are you live?
I am live.
Wait, I gotta introduce. Wait. I gotta introduce a newbie.
Oh!
A newbie. Let me get a newbie.
Come on, newbies
Come on,
everywhere. Guys,
let's get a newbie in
introduce
here.
you to some of the new staff.
All right, this is Tori.
Facebook Live, Instagram Live.
Tori, Michi, you better come over here.
Come
You're in
here.
the room.
Oh, we are live.
Come on, Michi.
Black Wednesday.
Hey,
everybody.
Yeah.
I haven't seen everybody.
What's up? Of course, I have no
Yeah.
makeup on. Oh my God, I can't
We're
believe
live. Look at all these people on our numbers. We're giving away free blood work here very shortly. Should we let one of the girls pick a number?
I want to pick. Yeah, Tori. Let's let Tori
It's a
pick.
random number.
Random number?
Just click this.
Hit it.
Look at this.
Wait, no.
It's for the blood work?
Blood work.
All right.
Oh, my favorite number.
5. Who got 5?
5.
Anybody with 5?
5. Ew, 66.
What up, Paul? We got all kinds. 67. It's 1 through 100.
5.
We got
I mean,
5.
I'll go comment my own.
I'll go comment 5.
I'll go comment my own 5.
Yeah.
Your jackets. I'm
Yeah.
gonna stop wearing like hoodies.
One more.
39.
39.
We got 29.
You got 38.
99,
Real close.
35, 29, 36.
Come on, guys.
Ew.
It's okay.
How many numbers are there?
Oh,
1
man.
through 100.
Sharice, your
Do
hand
another
is here,
one.
by the way.
Oh,
Lenka, get
no.
over here.
Lenka, get your butt in here.
Lenka!
New
Lenka!
staff, new
Now!
staff.
Now!
Lenka,
Yep,
this is your
we
induction.
are live.
Lenka.
39. We got a winner.
Initiation.
Wait
Get
a
over
minute.
here.
Rolo 66. You've won the free blood work. Rolo 66. 39 was the
Lenka!
number. Yeah, buddy. Here we go.
Lenka, you want to get paid tonight?
Congratulations. Call text
She's
or
she's not
DM
getting
us
no
your
drink.
information. You
No
have won the
drink.
free blood work. So, guys, we've given away free blood work. You guys want some more stuff?
Oh, yeah.
Should we give away some more free clothes?
We could do a pair of leggings.
More leggings? How about for guys?
What are they? They don't need anything.
Yeah,
I'm
right.
kidding.
A hat.
kidding.
A drop.
All right, hat. She
A
said a hat. A hat.
Hat?
Yeah,
Okay.
hats are
All right,
nice.
you guys get fitted hats. We've got the black. We've got Nike black ones, fitted, gray ones, blue ones. Paul, what's up, Paul? All right, cool. All right, so let's do
All right,
one more.
let's do a number.
Facebook and Instagram.
Let's do a number.
All right, click
Michi,
a
you
number.
gonna click it this time?
20. We got 20?
Dun dun
We
dun.
got
dun.
20, 20, 20, 20. Whoever we got 20?
No one.
No.
Ooh, that's John's favorite number,
I know, that's what I
23.
said. 23 is my favorite. All right, click it again.
I'll do it. Ew.
17.
That's ugly.
Anybody got a 17?
Nobody picked 17.
Oh my gosh, my site profile. Dang.
I know.
Michi's more worried
I
about
don't.
site
I
profile.
don't like. My hair looks bad too.
17 on the big screen. Let's go. Where you guys at?
17.
Nope.
All right,
Click it
Tori.
again.
Dang.
Come on, maybe you got the magic finger.
Oh shoot, I hit it
Okay,
for
me.
Teach.
46.
I should not be a 46.
Right. 45.
So close yet so far.
Yep. 44.
My God!
Wait. go, scroll down.
46.
Did we get one?
Oh, no.
No, he was 45. He won the blood work.
Like, just
I'm
kidding.
blind.
Click it one more.
Go ahead. 52.
52. I don't think I seen a 52 either.
No, not yet. Also, sorry, Jamie Hartzell, you can only pick one number.
All right, guys, I gotta go.
Don't worry, Jamie,
write
I
some
got
checks.
you. We'll get
This
you
is
shirt.
Tori.
Do it one more
Nice to
time.
meet her.
We're giving away
Michi.
free Titan clothing.
Bye.
Come on, click it.
Uh-oh.
Click it.
One more.
Yep. 3.
Nobody has 3.
No,
I don't think nobody clicked 3. Do one more time.
Boom. 54.
54.
Oh!
Yo, CarVG.md.
Yeah. Oh, you're a doctor?
We got a doctor in the house.
You're a
Awesome.
doctor.
Awesome. So you have won the Titan Medical Center gear. Please DM us. You will get the free Titan Medical Center gear, whether it be leggings for your wife. Hey, listen, they make great Christmas gifts, right? And we have all these different things for you guys. So,
Bye, guys. Happy
Who's that?
Thanksgiving.
huh?
What's his name?
His name is Yoel CarveG.md.
Wow, we had somebody named Leonard Laws pick 54 right when you
Wow.
announced it.
Okay, so he went. We'll give you on that one. So Facebook and Instagram are both covered, guys. So that's really, really cool. I'm glad I could give this away to you guys. We gave away the free blood work. Now, listen, you guys can still take advantage of it. So I'm going to give discounts on blood work for you guys right now. If you guys need a full panel for a male, listen, it's going to be $130. Take advantage of the special. I'm not letting it go anymore. $130 for males, full male panel. Females, $200. There's more testing on the female panels. That's why it's a little bit more money out of pocket. But you guys will get the discount. So call or text, confirm that you got it, say it's Black Wednesday special for the blood, and John will help you guys out with the discount. Also, if you guys want to do the blood test and you guys are getting vitamin amino acids, so if you guys are going to do the vitamin amino acid therapy, we'll give you guys a $50 credit on top of it. You guys will get 2 benefits out of this. So you guys will get a discount on blood if you guys didn't win today, and you guys will get to apply a $50 discount to your vitamin amino acid injectable therapies, right? If you're new or old, or you'll get it off your hormone replacement therapy package at one time, okay? So I really, really want to take care of you on this and kind of offer up some different things. So if you're a new patient coming in or you're an old patient, you've been with us forever, I appreciate both of you guys and all of you guys for that. And really, you guys make Titan TikTok, so we want to make sure that you guys are taken care of all the way. First-class therapies, first-class service. If we can provide any more service for you guys or any better way, please let us know. We like the feedback. We will take it, and we will run with it. Me and Sharice are in here, especially with the new location. We are invigorated. We are motivated beyond belief to get this going like you would not possibly think. Like, this place is so big. I try to show you guys, but you really just don't get it till you see. So at that point, if you can't stop in, come see us. Maybe I'll give you some free Titan gear if you come see us, just to stop by. If not, keep it locked to social media, Facebook, Instagram, YouTube, TikTok, Twitter. I'm going to start giving away some stuff during the week from now on, so you guys can all win every week, and it'll be like Black Wednesday every week, okay? I might not give away as many blood tests, but I will give away some, okay? And some free Titan gear for you guys, or credits, or something, so you guys will tune in, you guys will learn some different stuff about Titan Medical Center, and you guys can all benefit, all right? So I appreciate you guys for tuning in. Have a happy Thanksgiving if you celebrate Thanksgiving. If not, have a great day. Feast with your loved ones. Be around them. Be pleasant. Be grateful for what you have. No matter if you don't have anything or you have everything, be grateful for your life. Be grateful you're breathing, and be grateful that you woke up today. If you have family, give them an extra hug. Hold on to them tight, because you never know when that time is done. All right? Nobody knows. If I knew, I wouldn't be here right now. That's for sure. So thank you guys a lot. I appreciate it. Titan Medical Center, Black Wednesday was officially successful. I appreciate everybody that tuned in. I've seen a lot of you guys that tuned in for all 3. So if you guys did that, trust me, I'm watching, and you know I always take care of my people. So whether it's a free shirt, a V-neck, if you guys are a patient, stuff like that, I'll probably hook you up down the road. All right? I appreciate you guys. Thank you. Happy Thanksgiving. Much love from Titan.